Today I want to share with you my thoughts and views and research on type 2 diabetes. In the past few months, I have friends or family that have been going through type 2 diabetes, and some of them can be quite painful in terms of surgery required due to diabetes. And this has made me want to go deeper into this subject to understand a little bit more so that I do not become a burden for my family in future, or that's at least what I hope to be able to achieve by going a little bit more in depth to the subject. Yes, I'm not a doctor, but this doesn't prevent me from looking at research papers, at trials or articles to help me understand the mechanism and the differences. Or at the end of this session, I hope to be able to show you what tests should be done to better predict your precursor to diabetes. So hang on and I'll show you more information. Do you know what causes stroke, blindness, heart attack, kidney failure, amputation? You guessed it, type 2 diabetes. Type 2 diabetes is the leading cause of these symptoms or diseases or illnesses that I've mentioned. So yes, it is something very serious, and we should always be very mindful of what it can lead to. Okay, so what is type 2 diabetes? Type 2 diabetes is basically a metabolic disorder that does not allow blood sugars or glucose in your blood to be distributed to your muscles and cells in your body. There is a hormone disorder that is in play here that causes that. And another term for type 2 diabetes is referred to as hyperglycemia. And hyper stands for too much. Glycemia basically stands for blood in the sugar. So that is how sometimes you hear people saying hyperglycemia or type 2 diabetes. These are used interchangeably. It's just a more scientific name for that. Okay, so what are the types of diabetes? There are three main ones. Type 1, let's talk about type 1 first. Type 1 is basically a genetic type of diabetes, and this affects probably like around 5 to 10% of people in the whole world. And critically, what happens is that the pancreas is unable to make insulin, and insulin is required to control your blood sugar. I think I did the explanation before, so I attach a link here so you can refer to that video if you want to know more about carbohydrates and sugar and how insulin plays a part. So type 1 diabetes is more of a genetic disorder. So basically you can't produce insulin to be able to control your blood sugars, and this is detected, as I mentioned, at an early age. Type 2 diabetes, this is the one that we are most concerned with, and this happens to almost 90 to 95% of the population in the world. And this risk increases with age. So as you get older, because of your metabolic dysfunction and hormonal dysfunction, as you go along, it gets worse and worse, and it will start to manifest out at the later stage of your life. Some of them may get it early, but most of the time it takes a long time to manifest, and at the end of maybe 10 to 20 years, type 2 diabetes can start to creep in. And basically cells fail to respond to insulin, and that is also known as insulin resistance, and this is something that will start the whole process of putting you into a diabetic category. And the third one is gestational diabetes, and this occurs in pregnant women. I'm not going to elaborate further because my focus now is more on type 2 diabetes. And again, same for pregnant women, it develops into high blood sugar levels. Okay, so important now, how do we measure or test for diabetes or even pre-diabetes? So usually if you go to a doctor, they will ask you to do a fasting blood sugar glucose test. And when they put you in the range, yes, then they'll tell you, oh, you're fine. But remember, that is a snapshot of that point in time of just your glucose level. Of course, if by the time you see a glucose level that is high in your fasting glucose, that's already a little bit too late. Okay, too late in a sense is you detect it late, but it doesn't mean you cannot resolve it. Of course, you can still take steps to be able to bring your diabetes down. But before going to that, why not test for certain parameters, or we call biomarkers, to indicate whether are you in a state of pre-diabetic condition, or what are the signs that shows that you are probably going to that zone. So there are 4 of them here. I'm going to talk about fasting glucose first, which is the one I mentioned before. So again, you fast for around 8 hours at least, and then the level that you should see is about 3.6 to 6 millimoles per liter. Okay, that is the usual one you see at the doctor. But you should look at HbA1c. Again, I did something on HbA1c, so you can have a look there. Basically, HbA1c takes a snapshot of your 3 months average of glucose in your body. Okay, and this is there's a range for you to detect whether you're in the right range. So as you can see here, normal is less than 5.6%. If pre-diabetic range would be from 5.7 to 6.4%, and diabetes will be more than or equals to 6.5%. And this can be done from at your local clinic or your even hospitals. But usually this is not done until, the sad part is until the doctor detects that you have higher levels of glucose, fasting glucose, and that's where they start, okay, let's test for your HbA1c. But to help you further, you should do this when you go, just to know whether are you at some sort of a risk. That could tell you whether have your glucose level been on the rise already for the past 3 months. So try to get that up whenever you see your doctor for your blood test. Fasting insulin, this is not something that is done normally, and most doctors sometimes don't even know what it helps with. But basically, fasting insulin is similar to fasting glucose. It measures insulin after you have fasted. Remember, insulin is something that comes in to control your blood sugar. So if you have a good range of this, you have low insulin levels, it means that you are generally still quite insulin sensitive. But if your insulins are high, it will also indicate that, oh, you actually have you may be approaching insulin resistance. Why? Because your body is putting out a lot more insulin, and this can lead to insulin resistance in the future. So you want to keep your insulin resistance level at a low level, which means that you are insulin sensitive and it can easily grab glucose and process it. Okay. The last one, HOMA-IR score. It basically tests for insulin resistance. And why is it important? Because if you are insulin or resistant for your cells or your organs, this means that it takes more effort to be able to churn out to resist insulin. So this will lead to more and more insulin resistance, and it will finally cultivate into your body not trying to respond to insulin anymore. Take for example pancreas. Okay, if let's say your pancreas has been working so hard to put out insulin because you put in a lot of sugar, your pancreas keeps working hard to put out insulin. At some point, it's too much for the pancreas to handle, and it simply shuts off. And that's where insulin resistance occurs, because it's so resistant. The boy who cried wolf keep crying for things, and when you keep going out until some point, the villagers decide not to help the boy anymore. Same thing, the pancreas decide not to churn out any more insulin. So this is insulin resistant state. So this HOMA-IR score is important to know whether your body is it in that state or not. So the levels there are normal for less than 3, moderate is between 3 and 5, and severe cases will be more than 5. So I hope this simple explanation and tips on what to get measured will help you. I've personally not encountered this previously when I wasn't doing my research. All I knew was to get my fasting blood glucose done, and that should be enough to know whether am I in the diabetic range or not. But these 4 metrics that I mentioned previously can actually help you to give a better, more holistic view of what's happening, and maybe let you come to a decision to, or your physician to help you to embark on certain diets, or hopefully not medications, to be able to improve your exposure to diabetes. I hope you like this video, and if you do like it, please subscribe, give me a thumbs up, and I'll churn out more videos like this for you.